Hello, my name's Bruce Stevenson. I'm the guy on the left there. I've been a dentist for about 37 years now. Standing next to me is Linda Piccinini, who has worked with me for the past 30 years, first as a chairside and then as our office manager for about 20 years. We have combined forces, and we are now today's dental consulting. The purpose of this little video is to tell you a little bit about us and how we work. So we worked together in a practice that I founded in 1977. And a few years ago, I had a young associate come in, and he worked as an associate for a little while. And then he became my partner. And in June of 2013, I sold him the second half of the practice, and now he's my landlord. So I'm still a dentist. I'm still a little bit involved in that practice, and he's still following a lot of the systems that Linda and I put into place, and he's still very successful. What Linda and I are doing now is helping other dentists develop systems in their offices that will allow them to also be successful. We are dental people. We are not consultants who haven't worked in a dental office in 20 years. We still work in a dental office, our own. So we have a little bit different perspective than a lot of people do. I've been lecturing and talking about computers and practice management all the way back to about 1986. I've spoken at the ADA annual meeting and the AGD meeting and all over the country. I give a 5-hour course on dental practice management periodically. Linda, on the other hand, has done most of her stuff over the internet and in office. So as I mentioned, we kind of combined our talents now, and we mostly work over the internet with offices all across the country. So our philosophy is we are very practical and pragmatic. We have nuts and bolts solutions to many of the problems that the modern dental office is encountering. We're not real big into kind of fuzzy thinking. We're very into numbers and into checklists to make things better and get things organized. So what do we sell? We don't sell anything. Absolutely nothing. We do recommend certain products and services, but we recommend them because we found that they work very well and that they help our clients become more successful. But we get absolutely nothing from anyone other than our clients. So what's a successful practice look like? Well, these are the benchmarks that we look for in a practice, and these are the benchmarks that we strive for with our clients. Now, you don't have to write these things down, kind of a busy slide. You can download all these slides, including this one, from a link on our website when you finish watching the video. A couple things I would point out here. Most people have an AR that's rather high. It should be down to about 1/2 to 2/3 of 1 month's production. So that's one of our metrics that we measure all the time. Most offices don't tend to collect email addresses, cell phones, or certainly not referral sources. And so you can see the percentages that we want down there. Those are extremely important in the proper management of a dental practice. The last thing down below those are future appointments. The ideal is to have more than 80% of your patients leave the office with an appointment. Very common that we find this number down 30, 40, 50%. We want it to be above 80%. That's very important in the busyness of the office. New patients are very important, no question about it, but so are your existing patients. Don't let them walk out the back door. So how do we do this? How do we achieve these metrics? By doing these things. So these are our best practices. Basically, what we think of as our job as a consultant is to give you the pieces of the puzzle. That's really what this list is. But then help you put those pieces together into a smoothly functioning, profitable dental practice. That's our role, helping you put the pieces together. Here's the pieces of the puzzle. You can take these and you can use them yourself. There's a lot of information on the website. Our role is to help you put those together. I love this cartoon. I said that looks like Linda over there on the left. And what she's trying to do is convince that office to put some round wheels on their cart instead of the square wheels that they have now. But they're too busy, you know, they're going to keep doing things the way they've been doing it all along. This is Linda's favorite quote, and I think she's absolutely right. We are in the business of making changes in dental practices. Dental practices that don't want to change, okay, I mean, they certainly have the right not to change, but they really then should not expect that they will become more successful. So we want to put some round wheels on the cart in the place of the square wheels, and it does require change. So how do we proceed? First thing we do is listen to you. Schedule a little internet meeting and listen to you tell us about your practice. We then go in and collect some information, I'll talk about that in just a second, about your practice, and then implement the systems based on what we see with your practice metrics. We also monitor the results. Metrics are a big part of what we believe in and what we do. So how do we proceed? You're interested, you're all hot to go here. What should you do? So far, we're not going to spend any of your money. We're going to make arrangements to come in on your computer using GoToMyPC, so you have to sign up for the free 30-day trial version of GoToMyPC. And that's a remote access program that allows us to go into your computer and look at your office software and try to understand what's happening in your office. We're collecting some numbers, collecting some metrics. You need us to send you a HIPAA business associate agreement. Anybody who's coming into your computer that does not give you a business associate agreement is putting you at risk. This is a HIPAA requirement, and we do that right off the top. As I said, this is free. We schedule a 1-hour visit, come back and talk to you about what we saw. Some practices we honestly just can't help, but most of the time we can. We want to tell you how we would recommend we proceed. How do we work? What do we do? You decide you want to go ahead with us. We schedule 2 staff meetings a month, each about 60 minutes, sometimes a little bit longer than that, with your entire staff. And these are internet meetings. We can look at your computer, you can look at our computer. We have cameras at our end, you can have a camera on your end, which really makes it much more interactive. This is a staff meeting. We start the staff meetings usually the same way by looking at metrics about your practice and talking about customer service. We then go on to whatever particular project your office is working on. We have a variety of projects that depends on the needs of the office. We do a whole lot in between the meetings. If you think about it, the meetings that we do every 2 weeks are kind of the tip of the iceberg. And what we're doing in between is going in, gathering more information on your computer, again using GoToMyPC. We're on there rather frequently to understand what's happening in your computer and how we can make your office more profitable. So we do a lot of things behind the scenes, including one-on-one training with staff or one-on-two. For different staff members, we have modules basically for front desk, for chairside hygienists, and for the doctor. Those are in addition to the 1-hour staff meetings that are twice a month. So how much does this whole big iceberg cost you? It's $1,100 a month. There are no contracts. There's no commitments. You do it for 1 month. You decide, you know, this is really not for me. Great. We part friends. No problem. And you can quit anytime. And as a matter of fact, we may quit. And sometimes we find that we're just not making a change in a practice for whatever reason. So again, we want to part friends. We don't want you signed up for some 1-year contract that you can't get out of. That's not the way that we work. So that's how we work. We think that's fair. There's never any add-ons. This is it. We don't surprise you with any other charges. So if you have questions, we have answers. You can call Linda at the number down there. You can log on to our website. You can send Linda an email from the website. And hopefully we've answered your questions and maybe piqued your interest a little bit about how we do our consulting services.